94.4 FM, the Friday Sports Show of your host, Petruzzi. Bringing news from local area and around the world. And today we have a very interesting guest, a really important segment. We're going to be talking to Dr. Hilary Jones. Who's going to give us an insight into the NHS, who's going to be providing a service to help people get cancer screening. So to tell you more about it, Dr. Hilary Jones, welcome to the show. Great to have you on board.
Lovely to be here, Jimmy.
Thank you very much for joining us in a really important issue. And can you give us more of an insight into what the NHS busting service is, what it involves?
Yeah, so we have this lovely intentional pun, which is the NHS busting cancer tour. It's a bus. It's a stagecoach bus which has been decked out with NHS branding with the slogan, 65 out of 78 passengers on this bus would survive cancer if it was diagnosed early. 65 out of 78. That's an 83% survival rate for early diagnosis of cancer, which is fabulous. But what we do know is that 2/5 of people still don't come forward to see their GP if they're suspicious that something's wrong. So we want to raise awareness of the importance of knowing what those signs and symptoms could be, which could suggest cancer. And we need to encourage people to go and see their GP as soon as possible if they're worried. Understand how your body works, how your body functions, what's happening differently to normal, when to go and see the GP. Because what we know is early diagnosis not only improves outcomes, but it saves lives. That's what the Busting Cancer Tour is all about. And the bus is visiting Grimsby, Coventry, Nottingham, Basildon and Portsmouth, starting from today right through to the 1st of December.
No, it's really important, and I think it sort of goes without saying, but I mean, what's your take on it in terms of why this is really important? You've kind of touched on it there, but just for our listeners, why it's really important to have a service like this?
Well, we know that some areas of the country have lower rates of early diagnosis, and there could be lots of reasons for that. So there could be just a lack of education about what the signs and symptoms might be, but there might be cultural barriers, language barriers, difficult access to health services. There could be many reasons, and we've chosen those 5 cities for that reason. They have low rates of early diagnosis. And on the bus, there'll be healthcare professionals and brand ambassadors that can distribute leaflets and tell people what they should be looking for. They can also refer people quickly to services if they need to be investigated urgently. But on that, for everybody, knowing what's abnormal for you. So, for example, if you've got symptoms of a cough, a persistent cough or a changed cough for more than 3 weeks, that could be significant, especially if you're over 50 and a smoker. If you had a persistent change in bowel habit for more than 3 weeks, if you had heartburn or indigestion, which is just not going away, any kind of unexplained bleeding, unexplained fatigue or weight loss, any kind of breathlessness, blood in your motions or blood in your pee, which is persistent. These are kind of signs that, there could be something wrong. Don't just assume it's something trivial which will clear up on its own. Go and talk to your GP. The NHS will prioritise cancer treatment, so you'll be seen urgently. And already we are referring 200,000 people every month for referral to rule out cancers or to get early detection.
Yeah, I mean, I sort of was going to ask about sort of symptoms, and I'm certainly no medical expert, and but you've mentioned some symptoms for people to look out there. I mean, I'm sort of guessing that everyone's going to have, different types of symptoms, but you've mentioned some of the sort of key ones there. Is there anything else you can think of, Dr. Hilary, in terms of what people can sort of, I obviously don't want to alarm anybody. I'm sure that some of these symptoms might apply to other things as well, but as a general rule, like yourself said before, it's like, it's sort of better to err on the side of caution. Is anything else you can sort of maybe share that people might sort of take note and think, well, I better get myself sort of checked out, or is it worth getting checked out even if you don't have symptoms?
No, absolutely. We have screening programs for things like cancers, cervical cancer, breast cancer, other forms of cancer we can screen for, but not everything. So we are dependent on people, checking out things that are not normal for them. But look, it's probably nothing. People with these symptoms, should get them investigated. By and large, it'll probably be nothing. But in a few cases, there'll be something that needs treatment. So other symptoms could be, for example, a woman who's a year past her menopause. If she starts bleeding, vaginal bleeding again, that's suspicious. Younger women bleeding between periods, then that could be something suspicious. Blood in the motions, which we screen for as well in the over 50s, of course. Frequent infections for no reason, whether it's chest infections or urinary infections, unexplained night sweats, unexplained weight loss, I think I've mentioned, unexplained bruising when you've not been traumatized or knocked. These are lumps. I haven't mentioned lumps, which are a common presenting sign. I think anything that isn't normal for you, if you're in the shower, in the bath, having a little prod and a poke of your body and you find something, don't assume it's nothing. Go and get it checked out, because it doesn't take long to do and it could save your life.
Absolutely, and I'm sort of like guessing what you mentioned before, that early intervention is going to give people the best chance possible. And with that, where can people find more information, please? So if they're listening to sort of the interview and they want to know a little bit more information, where they can sort of find more info, can you signpost them, please?
Yeah, sure. I mean, obviously there's a lot of information to digest there, but a good website is nhs.uk/cancer symptoms. You can also go to the Cancer Research UK website, or Macmillan Cancer Support. There's the National Institute for Health and Care Excellence. Nice. But of course, if you're worried yourself individually today, or you've got information from the tour bus and you want to get checked out, your GP should be your first port of call.
Yeah, and I really want to thank you for coming on the show, Dr. Hilary. It was really interesting and informative, and obviously could potentially save a life if people are listening in. The website's there, the NHS website, and certainly would recommend they sort of check it out. So thanks again for your time. It's been really informative, and have a great day. Thank you.
And you take care now.